Hi, I'm Danny Van Leeuwen. I'm Health Hats. Thanks for joining me again today. I care about what works for people on their health journey. I wonder how people make choices. How do lay people make choices for themselves with their clinical partners? So much affects our health. It's not just our medical decisions, but it's our behavior, our communities, the environment we live in, and the systems we use to survive and live well. Our choices are not just about medicine. I've always been interested in research, but I ask, how does this study help me? How does this study help my family? How does this study help the people who support and care for me? We are the people at the center of care. Just because we find out that something works in a lab or might work in a lab, will it work for us? So, as you know, I'm a patient. I have multiple sclerosis. I'm a caregiver and I'm a nurse. I'm a student of the health journey. What works? What doesn't work? Who does it work for? If it works for one, will it work for another? If science says it works, will it work for me? When I first read about Patient Centered Outcomes Research Institute, PCORI, I looked them up online and saw that they included people like me. I was eventually invited to join a group of 200 people in Washington in 2012 to meet with the staff of PCORI. And I began to review funding requests as a patient stakeholder. I was pretty intimidated. What the heck was I doing there with the scientists and the doctors and the administrators? But soon I understood why I was there. I understood about the day to day life of patients and caregivers, and I could talk about how being part of research would affect us and how the research results would affect us. I was respected too. I was respected and I was listened to, and I felt like I had influence, and it was pretty heady. I was able to say that we had to think about the caregivers and parents of people who were sick as much as the people who were sick. I was heard. I was able to say that pain couldn't just be treated with drugs and by doctors and nurses. Meditation, massage, chiropractic, physical and occupational therapy helped too. I was heard. I was able to say that people wanted to live the best life possible and get over what ailed them. But they had to deal with transportation. They had to deal with taking their kids or their taking care of their kids or their parents. They had to keep their jobs. They had to pay the rent. It wasn't just about adherence to medications. We had to consider real life. I was heard. So then I asked, if research doesn't get to the people at the center of care when they need it in a way that they can understand it, that research is just ink on paper. I don't have the time or interest to go to professional conferences, read professional journals. I'm making health choices at the dinner table with my family, having coffee with friends, taking a walk with somebody, having lunch at the office, and frankly, not so much in the doctor's office. So, what's the best way to get research findings to us where we live and gather? I was heard. I was appointed to PCORI's Communication Dissemination Advisory Panel. Right now, and I was elected co-chair. And right now, the panel's talking about uncertainty. After all, research says something might work better. A might work better than B. Research isn't done if it's for sure. I mean, who studies whether it's smart to look both ways when you cross a street? I think life is uncertain, and we should just get over it. Life is uncertain. Research is uncertain. And I think that trust is more important than certainty. When I build a team uh, that I trust, and they recommend and I follow. Uh, Not blindly, I think, but I think trust is more important than certainty. I think we should study that. So, I know enough about science to be dangerous. I know enough about research to be dangerous. But being involved with PCORI, so many scientists have taken the time to explain to me about the science and the research so I understand. And I appreciate the challenges of science, and they appreciate now the challenges of life. Um, Lately, I think that the scientists think as much as I do about the life flow of the patient and the workflow of the clinician. And I understand that the research we review might really matter to people, but if the science isn't solid, we haven't learned anything that we can share. I respect PCORI because it's a learning organization. It includes patients, it listens to patients, and I've seen it change how it does their work because of what they've learned for us. And they spread the word about the value of patients. So PCORI was funded as part of the Affordable Care Act. Its funding ends in September of 2019, and I hope that Congress educates itself about PCORI and listens to constituents who benefit from PCORI's work to ultimately support that reauthorization. So I'm going to Washington on Tuesday to lobby my senators and my representatives. Thanks. Good talking to you. Bye.